we come here today to update our citizens on some of the latest efforts in combating this crisis. Here in New Hampshire, we value individual and community responsibility, and in these unprecedented times, the people in New Hampshire truly have a great responsibility. We must be accountable to each other, and it's imperative that everybody stay safe. But people must make smart decisions and stay at home and keep using smart social distancing as much as possible. Many people are already doing this, but it is a message that we truly cannot repeat enough. Of course, we're not telling people they can't go outside and enjoy the outdoors, go on walks and hikes while practicing common sense social distancing. You can continue to do so, but please practice smart decision making and avoid all unnecessary situations that could put you or your neighbors at risk. How we act in these days and weeks ahead are going to be very important. If it becomes clear that we're unable to continue with the social distancing, further action may be necessary in order to ensure the health and safety of our neighbors. And to those over 60 and with other identified risk factors, it's important that you stay at home. Whether it's offering to pick up groceries for an elderly neighbor or shoveling their sidewalk during tomorrow's winter storm, it's imperative that we come together as a state. Also, in accordance with CDC guidelines, New Hampshire will now be issuing guidance prohibiting scheduled gatherings and events with more than 10 people. I'll now turn it over to Dr. Chan to give us our daily update of where we stand.
Great. Good afternoon, and thank you, Governor. So I want to give a brief update in terms of the numbers for what we're seeing in New Hampshire for COVID-19, and then some additional public health recommendations for our communities. So to date, over the last 3 weeks, since our public health laboratory first brought on COVID-19 testing, our public health laboratories has tested over 2,400 people for COVID-19, and there are an additional 870 tests pending currently. So we have certainly ramped up testing for COVID-19 in our state. We are now announcing 101 individuals with COVID-19. That's an increase of 23 individuals from what we announced yesterday, and we will continue to release daily updates. The majority of these individuals are travel-related, either domestic or international travel-related, but we are seeing a number of individuals in various communities and counties throughout the state who have no clearly identified risk factors of contact with a confirmed COVID-19 case or travel. And this indicates that there is and continues to be community transmission of COVID-19 in multiple areas of our state. 11 individuals have been hospitalized with this disease. And I have the unfortunate news that today we're announcing the first individual in New Hampshire who has died from COVID-19, and I want to express our sympathies for the family and friends of this individual. This is an unfortunate situation and one that we certainly want to try and avoid, but we know that with this virus it can cause serious illness and even death in those who are more susceptible to serious infection. This individual that passed away over the weekend was an adult male who was over the age of 60 from Hillsborough County and had multiple underlying chronic health conditions. This is the exact group of individuals that is at highest risk for serious COVID-19 related complications such as hospitalization and even death. So I want to use this opportunity also to acknowledge that as a community, we need to do what we can to protect the more vulnerable individuals in our communities. And to Governor Sununu's point, we want to stress the importance of social distancing. Now, what does that mean? Social distancing means that people, when they are out, should maintain a distance of at least 6 feet from other people around them. If someone doesn't need to go out for an urgent or emergent issue, we encourage them certainly to stay home and certainly away from public gatherings of individuals. We know that many people are already doing this, but we want to stress again the importance of social distancing as a mechanism to slow the spread of COVID-19. As you've heard over the weekend and today, we have an increasing number of cases. This is expected and can be expected to increase in the coming days. And so we ask that everybody in their communities do what they can to limit the spread of this virus and protect those who are more vulnerable in our communities, for more vulnerable to serious complications of infection. I want to also acknowledge a question that we get often about whether somebody can potentially transmit the virus early in the onset of symptoms and possibly pre-symptomatically or asymptomatically transmit the virus. And I want to acknowledge that there does appear to be increasing evidence that this happens and potentially is one of the drivers of this pandemic. And for that reason, if someone has been exposed to another person with COVID-19, meaning they're a close contact, whether that person is confirmed to have COVID-19 or suspected to have COVID-19, those individuals need to take the extra step of staying at home and quarantining themselves to prevent further spread in our communities. We have stressed before the importance of anybody who has even mild symptoms of staying home. That remains the case. We also want to stress the importance of people that may be asked to quarantine at home, meaning stay at home, because of potential exposure, that those individuals please do so. I want a couple additional points here. Anybody that is more vulnerable to COVID-19, so people that are 60 years of age and older, or people with multiple chronic medical conditions, we want to ask those individuals especially to stay home as much as possible, limit contact with others. As the number of people with COVID-19 increases in our communities, the risk of acquiring this from our communities is increasing, and so these individuals particularly need to pay particular attention to remaining at home and practicing social distancing. And again, that is maintaining at least 6 feet, being within 6 feet of other people, avoiding being within 6 feet of other people, and staying home as much as possible. For these individuals, we encourage them to have at least a month's supply of medications on hand, and a supply of food and groceries. In these times, we also ask community members to reach out and support others in our community who may need a hand, who may need to make a trip to the grocery store, but are trying to limit their social outings. We encourage people in our communities to look around and reach out to others to see how we can best support those who we want to certainly protect. Finally, let me just mention that there are more than 350,000 cases of COVID-19 globally, and now more than 35,000 cases of COVID-19 in the United States. Right, so this is a virus that is rapidly increasing globally and in the United States. The United States is now the third highest country in terms of number of cases of COVID-19. So it's no longer just international travel that poses a risk to people acquiring COVID-19. We have a number of individuals who have traveled domestically and have come back to New Hampshire with COVID-19, and certainly, as you've heard, people can even acquire COVID-19 within our own communities. So we want to encourage people to the greatest extent possible that they avoid any domestic or international travel, especially if this is travel on public conveyances like buses and airplanes and trains. This is particularly important for those who may be over the age of 60 and people with multiple chronic medical conditions. Finally, I just want to say that, again, we expect the numbers to increase in the coming weeks. We are taking what I believe to be appropriate and aggressive action for trying to limit community transmission, but we need to, all of us collectively, take steps to distance ourselves from others, which can be stressful and potentially isolating. So we need to find ways, I think, to support each other in our communities, but we can expect to see COVID-19 increase in our communities, and we will continue to work with our local partners to try and mitigate the impacts of this virus in the coming days and weeks, and we're watching this and responding, watching the situation very closely and responding in turn. Thank you.
Thank you very much, Dr. Chan. I'd now like to take a moment to really talk about one of the successful models that we've put into place in the state, and that is with remote education and remote learning across the state. We charged the Department of Education with an incredibly ambitious goal just over a week ago to really get the entire state up and running in a remote learning atmosphere for our students, because we know education is paramount and we want to make sure that those opportunities continue on for all kids across the state. I'll ask Commissioner Adelblut to come up and talk about some of those successes. Thank you.
Thank you, Governor. So it was a little bit over a week ago that the governor announced that we would be shifting to a remote instruction plus remote support, resulting in remote learning for all of our students. Our school leaders and our teachers, our families, and really our communities all stepped to the plate and they have been working very hard to implement that. We've got a couple of graphics up here that illustrate the shift from 1 week ago until today, where we have seen a significant progress as we have moved to a model where today I can tell you that all of our students have access to remote instructional opportunities. Our expectation is that those remote instructional opportunities may not be perfect right out of the gate, but we are learning as we move along. As I like to say, our students are learning, but our families are learning, our educators are learning, and I think we all, as a state, are learning as we move through this particular crisis. I am encouraged that we not only have the remote instruction, but also remote support opportunities where we continue to provide through our schools and our community partners for our food programs for those students who are food insecure to be able to continue to support them. As well, we have worked very hard to make sure that all of our students, including our students who have individual education plans, are supported through this process as best as we can. And that means that we have been very creative and thoughtful in terms of how we continue to support students. So we should all be proud of our educational system that has stepped to the plate in this crisis. Thank you.
Great. Thank you, Commissioner Edelblut. And it surely is an area where New Hampshire is leading the nation and really creating a new model of opportunity for these students. So hats off not just to the commissioner's team, but the parents, the teachers, their principals, the superintendents, really everyone coming together to make this happen. And again, as the commissioner mentioned, we'll keep working on it. We'll keep refining it. You don't settle just because you accomplish the first goal. You keep pushing forward and seeing how, making sure that you can set that gold standard. As you all know as well, the state over the past week has experienced an unprecedented level of unemployment insurance claims, and we anticipated this given the necessary steps, in some cases very serious steps, that both we have taken and the opportunity that we've tried to open up for individuals to be able to file for these claims. And I'm not going to ask Deputy Commissioner Richard Lavers to come up and talk about where we've come in the past week.
Thank you, Governor. Good afternoon. To give folks an update as to the status at the department following about 1 week from when the governor took his aggressive action in expanding unemployment eligibility to individuals affected by COVID-19 across the Granite State. To date, we have seen 34,000 new individuals registering in the unemployment system. In addition to that, with the hotline that the governor created at 271-7700, we have seen approximately 10,000 individuals calling into that hotline that have received direct service, talking with a live human being, and they've been able to get assistance with answering their questions and with expediting that claim filing process. As the governor had indicated, from an unemployment perspective, this is really an unprecedented historic crisis. At the department, I can assure you that it is all hands on deck. Staff understand and appreciate we are on the financial front lines of this crisis. As the governor has emphasized with us, all of this new eligibility that he has created through the action this past Tuesday does little if employment security can't deliver the benefits to people that need them so critically if we can't deliver these right away. That being said, staff at the department worked through the weekend after having worked long hours throughout last week in order to be able to position ourselves to, as expeditiously as possible, process these additional claims. We should have benefits that are going into people's bank accounts by this Wednesday of this week, so 2 days from now. Expectations going forward for individuals that are just learning about the unemployment system right now, not having any experience with it in the past. Expectations should be payments will be made 8 days following that filing of that initial claim. Folks need to remember to read the instructions on the website, on the screens that they are viewing as they go through that application. There is critical information that needs to be followed in order to assure timely receipt of benefits. And a reminder, after filing that initial claim, individuals for each week of continued eligibility. So each week that they have either a partial or a total reduction in their work, in their hours because of COVID-19, they need to go onto our website and they need to file a continued claim. And again, that is for each week. That website, again, is nhes.nh.gov. Individuals can go on that website 24 hours a day, 7 days a week, and file their claim completely online. Again, for individuals that are having difficulty, the governor's hotline at 271-7700 will continue to be a resource for individuals 8 a.m. to 8 p.m. Monday through Friday. We will continue to have weekend hours as well from 9 a.m. to 5 p.m., both Saturdays and Sundays. We will continue to keep that resource open and available. And again, it's through the assistance we've been able to get through our friends at Emergency Management as well as the Department of Information Technology. With self-employed, that was another category that the governor created eligibility for with his action taken last week. Individuals calling in that have been self-employed, business owners, what we would ask for them is to have information that they would be able to reference to look towards their 2019 earnings, so we can work with them as we establish what their benefit rate would be going forward. But let me assure you, staff at the Department of Employment Security, they are ready for this. We are delivering, and we will continue to deliver. That being said, the Disaster Unemployment Assistance Program that the governor has continued to emphasize as being important to be passed on the federal level, we would like to emphasize how critical that is again. New Hampshire starts this crisis with a solid, solvent trust fund at nearly $300 million, but getting that disaster unemployment assistance passed from the federal government will be critical for New Hampshire as we continue to deliver these resources. And lastly, anytime there's a crisis, we always worry about potential fraud. And what I would instruct individuals that are receiving a call from the department that they might question as to whether or not it is legitimate, just simply hang up and return a call back to the hotline at 271-7700. Again, individuals from the department are making calls Monday through Friday, 8 a.m. to 8 p.m., Saturday, Sunday, 9 a.m. to 5 p.m. So it is not unusual to be receiving a call over the weekend. But if you are unsure as to that call, please hang up and just call back to 271-7700. Thank you.
Thank you, Deputy Commissioner. On that note, when it comes to the unemployment insurance issues, the opportunities coming out of Washington, we also want to remind folks that we continue to remain in constant contact with Senator Shaheen, Senator Hassan, Congresswoman Custer, Congressman Pappas. They've been working very hard in Washington to be sure. There's a lot going on down there, and I can assure you they are definitely fighting for every dollar and piece of financial opportunity that we can then operationalize and offer here in New Hampshire. Another area that we are working to address now in terms of planning is with our hospital system and the concept of surge capacity. All these steps that we've been taking over the past week are very serious. They require unprecedented sacrifice, really, on behalf of our citizens and our systems, on employers and individuals. But that means we have to step up and take some unprecedented steps to ensure the opportunity. And one is to ensure that our hospital system and our healthcare system can manage the influx of requests that are not just coming in today, but will likely be coming in the future. As we know, some of our healthcare providers, they are struggling financially, and that's why we set up a fund to help them maintain critical levels of care throughout the crisis. We set up the $50 million fund last week, and that will be operationalized very shortly. We know that as community spread continues, we need to make sure that the healthcare system is truly capable of managing any potential surge. And to that end, we're in the process and nearly complete in some areas to build out that surge capacity of beds across the state. Hospitals, towns, Department of Health and Human Services are surge planning to optimize the use of existing facilities and suitable space for the care of patients. They're also reserving the essential clinical staff, equipment, and other resources to meet those needs. The first area, a collaboration effort between the state and all of the stakeholders, will be operationalized at Southern New Hampshire University. Clinical operations will be led by Catholic Medical Center and Elliott Hospitals, with support from all stakeholders and partners. New Hampshire expects to implement similar models at 7 other clinical, what we're calling our flex areas across the state, established at appropriate spaces currently not in use because of the pandemic within the Granite State. The clinical flex areas will ensure appropriate regional coverage and faster discharge of patients with COVID-19 who will no longer need acute care. These actions will increase bed capacity for patients who are very ill. This will also allow hospitals to preserve medical surge capacity for patients most at risk and ensure that patients with COVID-19 or other healthcare matters receive the appropriate level of care they need. Each flex area may be used differently. We're giving them that operational individuality depending on the community need and available resources and the hospital's current surge capacity plans. Another area we want to discuss today is that in terms of testing. We are drastically increasing our testing capacity in New Hampshire. And although we are already currently a top 10 state in testing per capita, we'll continue to push that number up. In the next 24 hours, testing capacity in New Hampshire is expected to triple in size. While our current guidance on testing will apply, these new efforts will allow us to expedite turnaround times and enable us to have the information we need to help slow the spread. It should also be noted that as testing increases, so will the number of positive cases. And that's very valuable data, which will allow us to isolate and help those with COVID-19 on a more rapid response. The days of playing pickup soccer at the park or having a neighborhood barbecue is temporarily suspended for the time being. We know that. This goes with the social distancing efforts that we started a couple weeks ago, some of the additional efforts that we've taken in the past few days, and we may have to take more efforts. But I want to thank the citizens of the Granite State. There were a lot of folks out and about. We saw folks hiking this weekend. We saw folks even out at the beach. And even with those larger number of people visiting, we saw people truly taking the social distancing very seriously, and we want to commend them for that. The more flexibility that the individual of the state can give us at the state level in not imposing harsher and stricter regulations and lockdowns and all of these things we hear, that's going to allow us to really move forward through this, not just looking at the economics, but the surge capacity, allowing us to get our testing up to really superior levels so that we can identify these things and make those actions with those individuals, allow them to be isolated, and again, further suppress the potential spread down the road. So again, we just want to thank Granite Staters. One of the areas we see a lot of issue sometimes is with the lines at stores. And again, I want to commend a lot of the retailers out there, grocery stores and others, that have taken it upon themselves, whether it's limiting the number of individuals into a store, asking for a certain 6 feet of social distancing within those lines. A lot of folks really stepping up, taking that responsibility, again, giving us the flexibility so that they can maintain their operations and get products and services to the individuals that need it the most. We all know this takes a lot of sacrifice, and it will not be easy. But at the end of the day, I have no doubt the efforts that we have taken today are surely going to save lives. Suppress the potential spread and get through this in as positive a way as we can expect. So we ask folks to really do the right thing. Stay at home and keep you and your family and your neighbors safe and healthy. With that, we can open it up for questions.
You've got Mayor of Manchester and Mayor of Nashua now calling for basically shelter in place. What's your response to their request and why you're not going that route? I know you've discussed that just now, but specifically.
Sure. So look, we're trying to take a regional approach. I was on the phone with Charlie Baker and Phil Scott this morning. If you look at the actions being taken in our surrounding states, they very much mimic the actions we're asking and taking here, very much so. In terms of social distancing, we're now limiting the number of gatherings to 10 people. When it comes to businesses, we're allowing businesses and encouraging them to go more with a telecommuting, right? We want folks to be able to work from home, to flex people's hours, to provide that opportunity. We understand that not everybody can do that. But again, the fact that I think a lot of these things have been put into place, similar to what you're seeing in the states around us, it really is a regional approach. So again, we're on the same page with those other states. I understand the concept of shelter in place. Even if you look at what's going on in a state like Connecticut, for example, virtually all the businesses are open. They're not preventing people from going out. They're not preventing people from accessing most of their public places. We're doing that at those exact same things here.
So, Governor, how are things working for state employees in terms of which state employees are directed to work from home and which might
So
not-
I've instructed all of our commissioners to allow any state employees that can work from home to work from home, to trim down all those services as best we can, and I guess flex those services. We're not necessarily cutting services at this time, but we're just looking to flex the opportunity for employees to work from home, maintain their social distancing. And so far, it seems to be going very, very well. We did a call, not today, but late last week, and a large number of state employees are working from home, and we hope that folks in the private sector mimic a lot of the efforts taken here at the state.
And is there guidance that's been given to state employees about how, we were contacted by somebody who works for the state who said they were directed to use their sick time against not showing up, and does that create disparity?
So the state has put together, the state has put together a guidance document. There are certain guidances, if you will, that have to be mimicked for all state employees. But again, we're giving our departments a lot of flexibility in terms of how to, whatever flexibility we can to enact that.
Are you contemplating these clinical flex areas to be housing only COVID-19 cases, or could there be other?
It'll really differ. It depending on the needs. So we're letting all the flex areas, depending on the surge plans that are already in place in most of these hospitals. We're bringing all the stakeholders to help them operationalize that. Understand that COVID-19 is very unique, and again, wherever the housing or the beds that they may expand into are, they'll have the option to figure out how best to utilize those beds.
Why are,
Oh, sorry. Hi.
why are daycares still open? And then secondly, can you talk a little bit about the reusable back order?
I missed the second question.
Reusable bags.
Oh, the reason, sure. So first, let's deal with childcare. So I was on the phone this morning with the folks within Health and Human Services that are putting together a plan. A lot of the childcare centers, they want to stay open. We want to encourage them to stay open because we need those doctors and nurses and healthcare workers, those essential employees on the front lines. Again, if they don't have the childcare, that could cause a real backlog of workforce in terms of being able to really go after this crisis. So we have a plan that we're putting into place. We'll be putting some funding behind it. I think that'll be released in the next couple days. I think they're actually on the phone right now with a lot of those providers, getting that feedback from those stakeholders to make sure what opportunities that we can provide. Your second question was about the bag order within grocery stores. I had friends that work in grocery stores, and they called me, I think it was Saturday or Sunday, and said, they were using gloves and taking appropriate measures for themselves, but they were concerned that the next customer, while putting their hands in those reusable bags, they didn't want to be transmitting a potential virus from one customer to another. I give a lot of credit to the grocers, to Market Basket. They all stepped up, and really in a matter of hours, we're ready to implement a plan that goes back to paper and plastic bags, new paper and plastic bags, to ensure that when you walk out with your groceries, you're walking out without COVID-19.
You mentioned the testing capacity expanding by threefold. Do we have as Dr. Chan was talking about, the reagents, the swabs, are those going to be backfilling now, or are we actually going to have that capacity, or are we going to be still waiting for that stuff?
So we have a whole shipment of the swabs coming in, but how they use, what reagents they need, with the testing capability that Dartmouth-Hitchcock has really opened up. They've done a fantastic job with these two new machines that should be up and running today, tomorrow, and that, again, it's done in a very different way. The sampling is done in a very different way, which allows much more flexibility and operational capacity to get those tests done. That'll really help us make sure that first responders or nurses or doctors that are quarantined because they may have come in contact, we'll be able to make sure that those folks get prioritized and we can get them right back onto the front lines of dealing with the crisis. So it's really going to provide a lot of opportunity. But as we said, the numbers are going to rise because we're just going to have much more information, which can be a scary thing to see the numbers drastically rise. That's very much anticipated, but it's a powerful thing in terms of having that data and being able to isolate folks much, much faster than we previously would have been able to. I believe Dartmouth-Hitchcock is also going to, down the road, whether it's this week or next week, look at satellite locations, again, to allow some of that testing to take place at a much more rapid pace. And again, these are the tools that we can put into place that gives the state a lot of flexibility to be making the best decisions in the interest of the citizens. So it's moving forward very rapidly, and it's a very positive movement, one of the biggest movements we've had with testing in the state.
I've got a question for Dr. Chan.
Sure.
You mentioned this morning that the state is moving towards, I think, what you call new case definitions that will include categories for people who are suspected to be infected with COVID-19. When's the state going to start reporting that number, and what's that going to tell us about the state of things once it is reported?
Yeah, so that's a good question. And so I mentioned this morning when I was on NHPR that the state is in the process of developing what we call case definitions. And case definitions are partly for reporting, but largely are also necessary for taking public health action. So, for example, in a situation where someone is diagnosed with COVID-19, confirmed with COVID-19, and they have a family member who's a close contact and also has symptoms of COVID-19, that person may or may not be tested, right? I mean, testing is up to the provider. You know, last week we announced sort of a set of individuals that we were recommending be prioritized for testing in the setting of some limited resources like personal protective equipment. So not everybody who has symptoms of COVID-19 will likely be tested. But there are certain individuals who are high risk or high concern for COVID-19, and if they were to develop symptoms, we would want to risk stratify them so that someone, for example, as in the situation I mentioned, that's a close contact of someone with diagnosed COVID-19 who might have compatible symptoms, we would use these case definitions to initiate some type of public health intervention to find out, well, is that person a healthcare worker? Do they then need to be brought in for testing, or are they able to self-isolate at home with their symptoms? So these case definitions that we create are directly used for how we conduct public health investigations and who we prioritize for investigating to identify potentially high-risk individuals that either may need to be brought in for testing or additional messaging that might need to be put out to those individuals' contacts who might also then need to monitor for symptoms, for example. In terms of your question about when we might be reporting those, I mean, there's not a plan right at the moment to report differences in confirmed versus probable cases. We oftentimes will do that, but we're still actually developing the case definition right now. And so in the future, that might be a possibility, but right now we're only reporting out confirmed numbers of cases.
Dr. Chan, how are you going to announce, certainly as the number of fatalities increase, is it only going to be announced people who have tested positive and then passed away? Or with this new designation, are you going to be able to, because it seems like you'd have almost, I don't want to say inaccurate, but not a complete read on the entire number of fatalities if you're only announcing just confirmed cases. So how do you do that moving forward?
Yeah, so certainly if there are individuals with unexplained deaths, certainly if they're in the hospital, if people are hospitalized with severe respiratory illness or fever, those are individuals we would certainly prioritize for testing, even if they're hospitalized before they end up passing away. If there are unexplained deaths in the communities, that's where the medical examiner gets involved, and there's testing that can be done through the medical examiner for any suspicious or unexplained deaths, and that's something we would work closely with the medical examiner around. But oftentimes the decision, those kind of decisions are up to the medical examiner and the situation on a case-by-case basis.
And as a doctor, how do you feel about, I mean, some of these public gathering spaces, they're outdoors. We were getting pictures sent to us from Mount Major over the weekend that looked pretty crowded. Mm-hmm. So where do you draw the line there on what's safe?
Yeah, that's another good question. Again, we want to encourage people to be active outdoors, healthy, getting exercise. We believe that being outdoors dramatically reduces someone's risk. So we don't want to tell people to not go outdoors, but at the same time, I think people need to pay attention to some of the guidance. And if they're hiking or walking, again, avoid being in large groups of people. And if they are hiking with someone, try and maintain a distance of at least 6 feet.
What do you mean by reduces someone's risk? Can you just explain that?
Yeah, so being in the outdoor environment is, where there's, free-flowing air, where there's sunlight, UV light will oftentimes inactivate some of these viruses. And I think it's important to remember that, again, the main risk here is being within 6 feet of someone. So I don't want to give the impression that, being outdoors, eliminates any risk. So certainly someone can be outdoors and, talking face-to-face with someone, and, and if they're infected with COVID-19, could contract it from them. But the risk, we believe, is less because, the wind is blowing, the sunlight is shining. Generally transmission is less in the outdoor environment, but not zero. And so people still need to pay attention to the guidance around avoiding, avoiding gatherings, large group gatherings, and trying to maintain at least a 6-foot distance between people.
So, Governor, is there anything else you can say other than the Southern New Hampshire University location for these flex city?
Yeah, so the Southern New Hampshire University location is the first one that is set up, ready to go. But there's others across the state that they're working on, and they're working very rapidly. And it's been very impressive to see not just the hospitals and the state come together, but all the different stakeholders in the area that need to make sure that something like that can be operationalized on a moment's notice. So we'll, I guess, as more and more get set up, we'll be able to announce them. But again, we're going to make sure there's regional coverage there. Right now, we're looking at 7 locations. It could expand to more. I mean, anywhere we can create that opportunity, we will. To be honest, it could, like Southern New Hampshire, it could be within their existing facilities. It could be within a dorm facility. It could be in a hotel. Folks have come up and actually offered their entire hotel to the state, and for wherever we want to use it. So there's a lot of opportunities of folks stepping up and making great offers and sacrifices on their own part to make sure that not just we have the surge capacity, but we have materials. You heard all the stories this weekend of people adapting their business models, right? What they're manufacturing, what else they can do. Groups that want to make gloves or make face shields or make masks. Folks from New Hampshire all across the state stepping up, dozens of companies wanting to help and willing to change those models. And again, that's incredibly refreshing. This is an all-hands-on-deck effort. Everyone's taking it very seriously, and those are the types of actions that are going to get us through this. And again, I don't want to say in a positive way, it's probably not the right word, but in a way that we can say we did everything possible to again, meet the needs, create the opportunity for individuals, create the suppression that we're going to need on this virus in the coming months, and get through it in as successful a way as possible.
The president mentioned a company in New Hampshire, I think it was yesterday.
They did, yeah,
A
he did.
fabricator company that's going to be
Yeah.
trying to make ventilators. Who's he talking
Yeah.
about?
I'm not at liberty to say, and to be honest, there's like 3 or 4 of them that he could have been. I haven't spoken to him since he made the comment, but we do know there's 3 or 4 different different groups, and been contacted by a couple more today that were willing to step up and just, some want to make the entire devices, some just wanted to make some of the smaller parts that were needed. Some are looking to provide 3D printers, because you can do this in it very quickly with 3D printers potentially, which is kind of exciting. Those plans are open and available. So we have folks within the state that are trying to make sure that whatever someone wants to do, they're going to meet certain NIOSH and OSHA guidelines and the specs, if you will, so the product has the integrity that it's supposed to have. But again, we're trying to facilitate that as quickly as possible, and everyone's stepping up trying to do something a little different, and it's great.
We're going to the level of coordination with local EOCs right now in terms of, I know this building obviously, or the other building, you've got a lot of people there, but the level of communication with the cities where there are bigger health departments.
Well, it's been really constant. Right now, Perry Plummer, the Assistant Commissioner of Safety, is really driving the operations within the Emergency Operations Center. He has a lot of those contacts, and he's on the phone with literally hundreds and hundreds of folks at the local level. I think 400, 500 people per call sometimes at the very local level, so they know exactly what's happening at the state level, what opportunities are there, what resources will be available. We're able to field their questions as well. And again, every city and town has somebody in their city and town pretty much that is that local emergency coordinator. It could be the fire chief, it could be the police chief, it could be a selectman. I mean, it can be a variety of different folks, but they're on those calls, interacting with the state to make sure that the resources are where they need to be.
We've seen some comments on social media from residents in the Lakes region who have noticed that a number of people were moving into their second homes over the weekend. Would you discourage out-of-state residents from using their second residence here?
I'm not going to discourage it. Look, this is a bit of a regional approach. That's why we talk to what's going on in Massachusetts or Vermont or Maine on a constant basis. We're not saying, no, you cannot travel. If folks want to come up and use their homes, and because they know they're, again, when we're talking about social distancing, we're talking about more isolation in their homes, and it's understandable that people want to get out of the city. We want to prevent that transmission as much as we can. But look, in the long run, we know these numbers are going to increase drastically. They just are. Again, as long as folks are coming up and being responsible, using that social distancing, understanding that we're going to limit things to groups of 10, very similar to what you're seeing in Massachusetts or Vermont in our partner states. The rules don't necessarily change because you come to New Hampshire. So we don't want to discourage it, but we just really encourage folks to be smart about it and use a lot of the guidelines that we've put in place here in New Hampshire.
Can we hear from you and Commissioner Edelblue on the potential extension of coming back to school? I guess for parents who are out there thinking of long-term planning, how long we're going to be teachers?
Sure.
Just what the outlook is.
Well, I'll start by just saying that, again, we're going to review that option in a couple weeks. This crisis is not going to go away in a couple weeks. So the likelihood of continuing that, I think it's more likely than not, because just because we still see the numbers increasing and the surge still potentially coming. But I think the good news, and I'll turn it over to Commissioner Adelblue, is that we've really allowed that flexibility, right, in terms of making sure that not just whether it's 2 weeks from now or 6 weeks from now or next year, right, what we've created just in 1 week here is something that can be lasting for quite a long time, and it gives options to close that opportunity gap, to give options for that family or that child if a crisis should hit. So again, we will go through that review. We're not promising anything right now, but I think it's more likely than not that it could be extended.
And I don't really have much to add to that, but we obviously, April 3rd is a reevaluation date. We have signaled to the schools that it's likely that it may continue and plan for that inevitability.
I'll say one of the things, one of the other opportunities there, because this got up and running so fast, I mean, it was just unbelievable to get almost every town. I've heard from a lot of districts, and I know the commissioner has as well, folks now saying, well, okay, well, how do we adapt our lesson plans? Like, let's keep refining it, what we're doing, adapting it, because what happens in a classroom, just picking that up and dropping it onto the kitchen table, that doesn't always work it can happen, and it has in a lot of cases, but now a lot of the teachers are stepping up and getting that feedback from parents or students, adapting their plans to be more conducive to that home learning environment, and again, that's kind of exciting because they're interacting. The fact they're using a lot of the online resources. You have classrooms. My son got up and he said, look, I got class at 9 o'clock. It's scheduled, it's on time. They're meeting as groups online to create those opportunities. Not everybody can do that. We understand there's some limitations in certain districts for that. But again, as we can increase those opportunities and create that learning environment that's conducive to that individual child, hats off to the teachers for going the extra mile and making it happen.
The search for PPE, I know you were mentioning that some of the swabs, you're going to be able to work around that on the testing, but for instance, masks.
Yeah.
What's the status there for hospitals?
So late last week, the states finally got permission to actually contract directly with a lot of the commercial providers that were for a while being prevented from doing direct contracting with us. So that door has really opened up. So we've placed orders with commercial providers on masks, gloves, gowns, all across the country. Those orders are in, and we suspect those shipments will be received in the next few weeks. There's obviously a lot of run on that demand, but you have folks like 3M. We've heard that story a lot. They've ramped up to literally tens of millions of masks in production that should be shipping very shortly. So that's the good news. We still have to bridge this kind of logistics gap, if you will, right, until we get those shipments. On the other side, we have FEMA, and we've gotten our first request out of the Strategic National Stockpile. That was great. We go through that pretty quickly, and that PPE is really being distributed out to all the healthcare providers as fast as we possibly can, as they are kind of burning through their stockpiles and reserves. We've made a second and third request onto that Strategic National Stockpile, and we expect those to be delivered shortly. To be honest, it's been a bit frustrating dealing with Washington in terms of getting those reserves here. When it comes to the extra stuff, the state is now kind of turned into a provider, if you will, of PPE, not something the state traditionally did. So we're a little bit beholden to Washington, D.C., waiting for that reserve stockpile to be delivered. We're hopeful it'll be delivered in the next couple of days. That'll allow us to bridge that gap till all the rest of the commercial orders really start coming in. The state's making commercial orders, the hospitals are, providers are. We just want to have that backstop for folks that run low. Okay. Well, thank you guys. Again, we're going to be as transparent with information as we can. We thank everybody in the state doing their part, stepping forward. We are asking a lot of folks. We really are. We're asking folks for a lot of sacrifices right now, kind of change the model of how we do things. We're taking this regional approach, working with our partners in Connecticut and Massachusetts and New Hampshire on all the different aspects of what's happening here. So again, we're all on the same page going forward. And we just want to thank everyone for looking at those guidelines, taking social distancing seriously, looking for opportunities to provide a work from a home, and then most importantly, all those folks that are really stepping up, and whether it's changing what they're manufacturing, doing what they can to help folks right here in this state. It's just been awesome to see, and again, with that type of effort, we're going to get through this. Thank you, guys.